Coronavirus cases are up nationwide, mainly thanks to one subvariant. But concerns go beyond just cases. The CDC says hospitalizations have doubled since May. NBC News analysis finds 30 states are seeing a rise in cases over the last 14 days. The CDC says Omicron Subvariant BA.5 accounted for nearly 2/3 of all cases for the week ending July 9th. NBC News medical reporter Erica Edwards joins us now to talk about this. Erica, Dr. Anthony Fauci says there's no indication that these new COVID subvariants are more dangerous, but we are hearing about a lot of stories about reinfection. So what are the experts watching right now, and what are they saying about keeping yourself healthy as these cases rise?
Hey, Zinkley, yeah, you're right. Those reinfections are occurring because these subvariants, BA.4 and BA.5, are just so good at infecting people, even though they may have previously been sickened or been vaccinated. A lot of us had our last booster shots last fall. Now that immunity is certainly waning. Now, as far as staying safe, the old advice still applies. Masking can help if you are indoors in crowded spaces like airports. White House COVID-19 response coordinator Dr. Ashish Jha addressed this very question this morning on Today.
And
the virus spreads when people are spending more time indoors. We know that happens in the fall and winter, especially in the northern half of the country. Right now, we're seeing a lot of cases up in the southern parts where it's hot and people are spending time indoors, and it certainly is a harbinger of making sure that we plan for a fall and winter surge of infections and be ready if that happens.
Now, Dr. Jha also urged people that if they are eligible for a booster now, to get it now. Even if it doesn't absolutely protect against infection, it can certainly reduce the risk for complications. Zinkley?
Definitely helpful to know. So let's talk about what's happening inside hospitals nationwide. NBC News data finds average daily COVID hospitalizations are up nearly 19% in 2 weeks. Cases in ICUs are up 22%. So how are hospitals handling the influx now and also gearing up for another potential surge?
Yeah, so I spoke with about a dozen different hospital systems across the country over the past 24 hours. All of them tell me they are indeed seeing this uptick in hospitalizations. Right now, things seem to be manageable. But the concern here is that this increasing uptick in hospitalizations will only further stress hospital systems that are already stretched thin, especially 2+ years into this pandemic. Zinkley?
Erica Edwards, important analysis on this pandemic. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.